Lesson 4 covers vital signs and patient monitoring. These are skills every radiographer performs before and during imaging, and the ARRT tests them heavily. Knowing your normal ranges, recognizing critical values, and knowing when to stop and escalate. That's what this lesson is about. Let's get into 5 vital signs. Memorize these ranges. Temperature. Normal oral is 98.6 degrees Fahrenheit, or 37 Celsius. Acceptable range is 97 to 99. Above 100.4 indicates fever. Pulse. Normal adult is 60 to 100 beats per minute. Below 60 is bradycardia. Above 100 is tachycardia. Respiration. Normal is 12 to 20 breaths per minute. Assess rate, rhythm, and depth. Blood pressure. Normal is less than 120/80. Hypertensive crisis is above 180 systolic or 120 diastolic. Stop the exam. Escalate immediately. And SpO2 oxygen saturation. Normal is 95% or above. Critical is below 90%. That is a stop everything value. Blood pressure classifications are a high-yield registry topic, from lowest to highest. Hypotension below 90/60. Assess for shock. Notify the provider immediately. Normal, below 120/80. Proceed. Elevated, 120 to 129 over less than 80. Note and monitor. Stage 1 hypertension, 130 to 139/80 to 89. Document. Stage 2, 140 or above over 90 or above. Notify the provider. Hypertensive crisis, above 180 systolic or above 120 diastolic. Stop the exam. Call immediately. No elective imaging proceeds at this level. For pulse. Assess 3 things, not just the number. Rate, beats per minute. Rhythm, regular or irregular. Quality, strong, weak, or thready. Never just count. Feel what you're feeling. For respiration, count for a full 30 seconds and multiply by 2. Watch chest rise and fall. Do not tell the patient you are counting their breathing. When patients know they're being watched, they consciously change their rate. Observe, then document. Below 12 breaths per minute is bradypnea. Above 20 is tachypnea. Both require documentation and provider notification. The AVPU scale gives a rapid, standardized assessment of a patient's level of consciousness. A. Alert. Fully awake, oriented to person, place, and time. Alert and oriented times 3. This is your baseline normal. V. Voice. The patient responds to verbal or physical prompting. They're not fully alert but respond when addressed. P. Pain. The patient only responds to a painful stimulus, a sternal rub, nail bed pressure. This indicates significant neurological depression. U. Unresponsive. No response to any stimulus whatsoever. If your patient is anything other than A, document it, notify the team, and do not proceed without guidance. Before every exam, every single one, I run this checklist. Introduce yourself, name and role every time. Confirm 2 identifiers, name and date of birth. Observe, skin color, temperature, level of distress, posture. Ask, allergies, current medications, reason for the exam. Assess vitals as indicated by condition or protocol. Document your findings before you begin imaging. This isn't optional. It's a patient safety requirement and a professional standard. Shortcuts here cost patients their safety and cost you your license. 3 vital signs questions in the style of the ARRT. Think before the answer appears. The answer is B. Stop the exam and notify nursing staff immediately. An SpO2 below 90% is a critical value. Stop the exam. Get the right people to the patient. Oxygen requires a physician order. Your role is to recognize the critical value and escalate. The answer is D, 188/124. This meets the criteria for hypertensive crisis. Systolic, above 180 or diastolic above 120. No elective imaging proceeds at this level. Stop and contact the ordering provider or nursing immediately. The answer is B, responsive to voice. A gentle touch to initiate contact is in the V category of AVPU. The patient responded to a non-painful prompt. A deliberate painful stimulus, sternal rub, nail bed pressure, would classify the patient as P. Document any change from baseline and notify the team. We covered the 5 vital signs: blood pressure classifications, pulse and respiration assessment, the AVPU scale, and pre-procedure assessment. These show up on the registry, and they show up on every shift. Keep drilling.